Good evening, Philippines and the world. Today is Thursday, May 28, 2020. I am Harleen Delgado.
Join us in the next 45 minutes as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
And for the top stories tonight. President Rodrigo Duterte to announce his decision tonight on the recommendations of the Interagency Task Force on COVID-19 pertaining to the fate of community quarantine measures across the country.
Over 13,000 repatriated Filipinos stranded in the National Capital Region have been transported to their home provinces and cities. Those have some complaints.
Transport Network Vehicle Service, or TNVS, prepares for the possible resumption of operations when Metro Manila shifts to general community quarantine. The new coronavirus could claim around 305 million jobs in the second quarter of 2020, according to estimates by the International Labor Organization.
A hospital for the indigenous people of the Amazonas opens in Manaus, Brazil, which becomes the first of its kind.
And Know Why Grew and the popular Yellow Minions are back in the middle of the coronavirus pandemic. The Duterte administration welcomes the proposal submitted to Congress to extend the validity of the Bayanihan to Hilas 1 Act until September 30, 2020. The Bayanihan law is effective until June 23 only. It gives President Rodrigo Duterte additional powers to address the nation's need during the COVID-19 pandemic. According to Budget Secretary Wendell Avisado, they cannot seek a supplemental budget yet for the COVID-19 response due to the absence of new sources of revenues and targets and excess from government collections.
And we're glad that both houses, the House of Representatives and the Senate, have come up with a unified decision to extend the validity up to another 3 months, or at least up to September.
President Rodrigo Duterte is expected to address the nation tonight. According to the presidential spokesperson, the Filipino people will hear tonight the president's decision on the community quarantines in different parts of the country. The palace believes that Metro Manila, for one, is ready for less strict quarantine restrictions. Rosalie Coz, our Malacanang correspondent, will give the details why.
The Interagency Task Force on COVID-19 has given its recommendation on the fate of the community quarantine in Metro Manila and other parts of the country next week. The IATF proposes that the entire Metro Manila be placed under General Community Quarantine, or GCQ, for another 15 days. That's June 1 to 15, 2020. However, high-risk barangays in the NCR will be subject to stricter quarantine restrictions or localized lockdown by the National Task Force on COVID-19. Since the doubling rate of COVID-19 cases in Metro Manila has slowed down and its capacity for critical care has been intensified, Malacanang believes the National Capital Region is ready for less strict quarantine restrictions. However, the Duterte administration appeals for the public's full cooperation.
NCR is ready from the data that we have seen, but that really depends on the cooperation of everyone. Ilinawin ko lang po, kahit anong anunsyo ng Presidente mamayang gabi, pwede po tayong bumalik sa ECQ muli kung ang datos ay magpapakita na napakabilis na naman ang doubling rate. Cooperation po.
The IATF also recommends to the President to place other moderate risk areas under GCQ next week. while Cebu City, which is a high-risk area, has been recommended to shift to modified enhanced community quarantine on June 1. Most areas in the country considered as low-risk areas are recommended to be placed under modified general community quarantine or MGCQ starting next month. Local governments have until noontime tomorrow to appeal to the IATF for the risk classifications of their jurisdictions. The finalization shall be on May 31, 2020. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Over 13,000 repatriated Filipinos stranded in Metro Manila have already been transported to their home provinces and cities. But some of them complain about the slow process of quarantine clearance and COVID-19 testing, which they encountered when they arrived from coronavirus-hit nations. Asher Kadapan Jr. will be with us tonight to tell us why live. Good evening, Asher.
Good evening, Harleen. Harleen, more than half of the 24,000 overseas Filipino workers, seafarers, and other returning Filipinos stranded in the quarantine facilities in Metro Manila were already transported to their respective provinces and cities across the country. Based on the latest record of the Department of Transportation, there were already 13,568 repatriated Filipinos who were transported via land, air, and sea travel. This is in response to President Rodrigo Duterte's call to concerned government agencies to bring home all the stranded repatriates within the week. But some returning Filipinos couldn't help but complain about the long delay. Harleen, I talked to some of them this afternoon and these are their grievances.
Ay, napakatagal po, nabubuisi talaga kami dyan sa hotel. 2 buwan na kami dyan. March 25 na ako dumating dito. Ngayon lang nakalabas.
Dumating po kami dito April 14. Tapos dinerecho po kami sa hotel. Tapos doon na lang po, habang naka-quarantine po, nag-aantay lang po kami kung kailan may swab, kung kailan pwede makauwi.
Some balikbayan also grieve about the delay in obtaining the results of the swab test they had gone through. They explained that there were some newly arrived repatriates who received their quarantine clearances ahead of them.
Halos ng pag-swab test sa amin, ng April 9 pa kami na swab test, ngayon lang lumabas.
At the Ninoy Aquino International Airport and Parañaque Integrated Terminal Exchange, they will have to wait again for an airplane or bus to board. OFW Jerome Lamonte said he has waited for the next available plane to General Santos City since yesterday. But there were some repatriates who just arrived today but were able to fly before them.
Baguhin nila yung diskarte nila dito. Dapat may number o pangalan ilista. Para kung tatawagin, sir, tuloy-tuloy, sir.
Asher, what has the Overseas Workers Welfare Administration, or OWA, got to say on this situation?
Arlene, we talked to OWA personnel and they explained that they had some lapses in coordination due to the high number of repatriated Filipinos that need to be transported home. But they assure that they are doing their best to bring home the repatriates to their families safe. Arlene, the UNTV News and Rescue team will be monitoring the progress of the program in the coming days. Arlene?
All right, Asher, thank you for that report.
Meanwhile, the Zamboanga City government is preparing 2 facilities for more than 1,000 Zamboangueños returning to the province. The 2 facilities are namely Ateneo de Zamboanga, Lantaca Campus, and the Catbatangan facility. The expected returning Zamboangueños will spend their 14-day quarantine here. According to Mayor Beng Climaco, the returning Zamboanga residents must still undergo a COVID-19 test to ascertain they won't be carriers of the killer virus before reuniting with their families. Another reason, the mayor said, is the increasing number of COVID-19 cases in the city.
This is very, very important so that our numbers will not go up, given that we expect more than 1,000 Filipino returnees, Zamboangueño returnees back to Zamboanga City. But we will provide ample opportunity that they will be quarantined.
Authorities estimate that most of those returning Zamboangueños remain stranded in quarantine facilities in Luzon. Some are overseas Filipino workers and seafarers. Mayor Climaco vows to coordinate with the Labor Department and OWA for the local government to provide alternative livelihood and assistance to the returning Zamboangueños. It's a huge challenge for local governments to transport OFWs returning to their hometowns and provinces, especially if there is no document to prove their repatriates have tested negative for COVID-19. With this, the provincial government of Nueva Ecija requests from the Overseas Workers Welfare Association, or OWA, an advanced list of workers who are set to travel back to their provinces. For Nueva Ecija Governor Aurelio Omali, what they need is an accurate list from OWA for the provincial government to be able to provide the necessary support to OFWs and to apply the appropriate protocols on the matter. The Philippine Coast Guard, or PCG, has crafted a master list of the names of 36,832 overseas Filipinos. Those include OFWs, Filipino seafarers, and returning Filipinos who yielded negative results in the RT-PCR test conducted by the subtask group for the repatriation of OFWs. To access the master list, go to the PCG's official Twitter and Facebook account and then click the link on the post. The list includes the names of overseas Filipino workers who were declared negative for COVID-19 based on the list and batches of results that the PCG made available online on May 24 to 27, 2020. If you see your name on the master list, coordinate with any PCG or OWA personnel at the quarantine facility to process your repatriation to your respective home province or city.
The country's Department of Health says the case doubling time of COVID-19 cases in the country has slowed down, including the National Capital Region. Health officials say the case doubling time in the country is now just 1 week. Case doubling time is one of the basis for experts to recommend whether to relax or intensify the quarantine restrictions in certain areas with COVID-19 cases.
Based on our data analytics, dun sa mga ginawang pag-aaral ng ating mga eksperto, we have a case doubling time of 7 days. So kung dati, bago tayo mag-ECQ, meron tayong 2 to 3 days na case doubling time. Nung nagpatupad tayo ng ECQ, napahaba natin ang case doubling time to about 5 days. Ngayon, ang ating computation is about 7 days.
The Department of Health will start reducing COVID-19 test backlogs in the country to 0 tonight. Aiko Miguel, our health correspondent, will explain why.
The number of COVID-19 test backlogs in the country reached 12,000 2 weeks ago based on the Health Department's report today. COVID-19 test backlogs are samples or specimens from individuals who had undergone COVID-19 testing and await results.
Ang ating backlogs ngayon, 3,683 kahapon. Pero meron nga tayong target that by tonight, we will be reducing all of these backlogs to 0.
Health Undersecretary Maria Rosario Vergere added the country may expect the mounting of coronavirus cases in the coming days, with some to be attributed to those case backlogs. The Health Department explains the results of those backlogs still need to be validated. The validation process is still used, Undersecretary Vergere further added. The DOH also lacks personnel called disease surveillance officers who are tasked to validate cases. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
After his controversial Sarap Buhay remark on Tuesday went viral on social media, Senator Ronald Bato de la Rosa was asked by some of his colleagues to physically attend Monday's session. This was announced by Senate President Vicente Soto III during yesterday's session.
we are hereby directing Senator Bato de la Rosa to attend the session on Monday physically because he is becoming very popular in social media.
Will comply, Mr. President.
Tama yun, Mr. President. Tama yun, Mr. President. Para yung statement niya will be pagkatapos mahirap ng buhay kasi hanggang alas 10 sa dyan sa Senado.
Netizens expressed disappointment on the senator, saying his sigh of relief was insensitive as the country battles the COVID-19 pandemic. In an interview with UNTV News, De La Rosa clarifies he expressed relief because the session adjourned early and the discussions were more efficient with their current setup.
Kasi natuwa ako na mabilis yung pagtalakay namin sa mga bills at maaga kaming nag-adjourn. Kaya sabi ko masarap ang buhay. Totoo mo talaga na masarap ang buhay pag gano'n na trabaho, magaan. At saka work from home, hindi ka na mabiyahe. Nandun ka na tulog ng pamamahay mo. So yun ang sabi ko na sarap na buhay, work from home. Personal time na namin yun between senators na magbabatian, mag-saying goodbye.
When asked to comment on the netizens' reaction, the senator has this to say.
Sabihan ko sila, ang babaw nila. Ang babaw nila. Layo ng kanang interpretation doon na sabi ko. Ano bang masama doon? Paano ako naging insensitive? Bakit sinabihan ko ba yung mga kwan na masarap ang buhay? Yung mga naging hirap? Ano ngayon ang decree niya doon? Ang gusto na, maglulupasay ako, mag-iyak ako dyan sa after decision na hirap yung trabaho.
De La Rosa says he will comply with the directive and will attend the Senate session physically on June 1. Let's now take a closer look at the updated count of coronavirus cases around the world. From more than 5.6 million yesterday, the COVID-19 pandemic has now reached a total of over 5.7 million confirmed cases in 188 countries, regions, and sovereignty. The fast-spreading disease has claimed nearly 356,000 lives, while more than 2,361,000 patients across the globe have recovered from the new coronavirus infection. The United States of America today records more than 18,000 new confirmed COVID-19 cases, raising the number to almost 1.7 million. Noticeably, the USA breaches the 100,000 death toll. Brazil, from only more than 391,000 yesterday, has a total of over 411,000 confirmed cases coronavirus infection. That number includes more than 25,000 deaths. On the other hand, Peru, which has recently joined Brazil as the Latin American nations with the highest counts, surpasses the 135,000 cases mark today from yesterday's record of nearly 130,000. And in the Philippines, the Department of Health reports 539 new cases, bringing the total known patients infected with the COVID-19 virus in the country to 15,588. That's based on the Health Department's 4 p.m. report as of today. We have lost 17 more patients. Now the country's death toll stands at 921. With the help of our valiant medical frontliners, 92 more people have won their battle against the invisible enemy, raising the total recoveries nationwide to 3,598. That also leaves the total active cases in the country to 11,069.
Millions of workers are becoming unemployed all over the world, according to the International Labor Organization. The numbers could even mount up to 305 million more in the second quarter of this year. In the Philippines, the Labor and Tourism Departments are asking from Congress billions of pesos worth of budget to assist workers and sectors in the country worst hit by the pandemic. Ray Pelayo will give the details why.
The International Labor Organization, or ILO, has recorded a 4.8% decline in the world's working hours, equivalent to 135 million full-time jobs in the first quarter of 2020. For the second quarter, it is estimated to reach 305 million equivalent jobs to be added to the numbers of the unemployed. Most of them are from the Americas, Europe, and Central Asia. The ILO says the hardly hit are young workers, of which 1 out of 6 are now jobless. During a Senate hearing on May 20, Labor Secretary Silvestre Bello III said that around 4 to 5 million Filipinos could become jobless this year due to the COVID-19 pandemic. The numbers may even reach 10 million if the crisis gets worse.
Right now, Your Honor, we already lost 2.6 million workers resulting from business establishment going into temporary closure.
Correct.
And another group of business establishment are resorting to flexible work arrangement.
The most affected is the service sector, which includes tourism, hotels, and restaurants. On the same hearing day, Tourism Secretary Bernadette Romulo Puyat reported that tourist arrivals in the Philippines declined by 54% from January to April this year from the same period in 2019. This resulted in the reduction of 55% in tourist arrival revenue during the same periods.
With both international and domestic travel restrictions in effect for the entirety of April, there have been no visiting tourists and therefore no revenue for the industry for this month.
Now the Labor and Tourism Departments are asking Congress for 40 billion and 70 billion peso budgets, respectively, to assist workers and related sectors and cope with the effects of the pandemic. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Trade and Industry asks local government units to sit down with the Interior Department to review the guidelines for the no return, no exchange policy implemented in some malls like those in Quezon City. Dante Amento tells us why.
The Department of Trade and Industry, or DTI, has found out there are shopping malls in Quezon City which implement the no return, no exchange policy.
We informed them before that no fitting is allowed, and then there's no return, no exchange.
Nahawakan na nailabas na di ba?
But DTI Undersecretary Ruth Castelo says this might bring about confusion among customers. Based on Republic Act 7394 or the Consumer Act of the Philippines, this policy is prohibited. A customer has the right to return a product such as defective item.
Kasi doon sa yung no fitting policy nila, tapos no return, no exchange, it turns off the consumer. Mas lalong hindi bibili yung tao na pupunta doon dahil nga kung hindi nga naman kasya, anong gagawin nila doon sa bibili nila.
The DTI advises local government units to resolve the matter together with the Department of the Interior and local government. The DTI adds it is better to implement a unified protocol for malls to prevent confusion. Mall managements, on the other hand, disclose they are just following guidelines from the city government amid the COVID-19 pandemic.
Sa ngayon kasi yun yung that was imposed on us by the Quezon City government, so we are just following the guidelines.
Dante Amento, UNTV News and Rescue. We serve the people. We give glory to God.
Our Filipino ancestors had a system of trade called barter, in which goods or products were exchanged for different items with equivalent or a similar value. But that's without involving money during their time. Now, in the middle of the coronavirus pandemic, there's this thing called online barter that's gaining popularity. Well, this may even be beneficial for you. Monokson explains why.
A community in Iloilo has been a talk of the town recently because of what they call online barter. Barter, if you paid close attention to your social studies teachers back in elementary and high school, is a system of exchange or trade of goods without involving money. But this system of trade now has an online version. How does this system work? It's easy. First, what you need is anything you have at home or just about any product. Be it gadget, food, clothing, items, or anything you want to trade without the use of money as payment. Next, join an online barter group. and wait for the admin to approve your request. Once approved, you can start posting photos of the products or items that you want to trade. Put a detailed description. Indicate the estimated value of your item. Determine what product you want to exchange it for. As much as possible, post the actual picture of the item. And wait for other people to state their offers at the comment section. Once you have a deal, decide if you want the product delivered or meet up with the person. Just be nice because you might get kicked out of the group if you violated their rules and regulations. Online barter is beneficial to people in need during the coronavirus pandemic. So what are you waiting for? Search any items in your house you want to trade. Who knows, you might even get something you have been aiming for. Mon Hokson, UNTV News and Rescue. We serve the people, we give glory to God.
The Transport Network Vehicle Service sector is preparing for when Metro Manila shifts to general community quarantine after May 31st. Joanano will explain why.
Noel Gimbaulibot, a TNVS driver, has set up a barrier inside his vehicle as he prepares for the possible resumption of their operations on June 1. He also has rubbing alcohol and disinfectant available inside his car to comply with the minimum health standard required among public utility vehicles. Noel hopes he could hit the roads again once Metro Manila shifts to GCQ. He has no income for almost 3 months now.
Sa ngayon, hindi pa naman nawawala yung COVID talaga. So, ang pinakamaganda lang talaga, lagi lang maging maingat. Magsuot ng face mask, every time mag-spray ng alcohol. Ito mga lagi kong dala-dala. Tapos sa disinfectant.
To comply with the government's requirement, GrabPH will impose new policies on their partner drivers and passengers as part of the new normal. Among these is the cashless payment scheme, which aims to prevent direct contact between the driver and the passenger. Valid cancellation will also be accepted, wherein the driver may cancel the ride if the passenger refuses to wear a face mask or vice versa. Prior to their trip for the day, drivers are required to answer a health checklist on Grab's application. Last week, the Transport Network company conducted seminars for their drivers who were taught the health protocols. Grab says around 20,000 of their drivers are expected to resume their operations when GCQ kicks off in Metro Manila. As they are set to fly back on the roads, Grab says they will not impose any fare adjustment. But GrabPH is planning to file a petition with the LTFRB to appeal for a 5 peso per trip fare increase in the coming months.
The disinfection kits and disinfection measures is an added cost burden to the drivers. So we've made a proposal to the LTFRB to raise the per trip cost by a fixed amount that would help cover these items.
Meanwhile, Grab will not require their partner drivers to undergo COVID-19 testing unless they manifest symptoms. Brian Cruz says they have procured some test kits for their drivers. Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
The Defeat COVID-19 Ad Hoc Committee of the House of Representatives approves the new normal bill. Vincent Arboleda will tell us why.
The World Health Organization sees that the new coronavirus will stay for a long time and that an effective vaccine against it won't be available in at least a year. To better prepare the public for the new normal, the Defeat COVID-19 Ad Hoc Committee has approved House Bill 6623, or the Better Normal for Workplaces, Communities and Public Spaces Act of 2020. The bill aims to prepare and educate the public for life after COVID-19 restrictions are lifted and adapt to the new normal. Physical distancing, mandatory wearing of face masks, and checking of body temperature will still be implemented as part of the new normal. Hand washing and sanitation stations should be made available in places frequented by people. Procurement of COVID-19 test kits, personal protective equipment, and the conduct of mass testing will continue, along with innovations such as drive-through testing facilities, phone-in testing facilities, and others. For work, business owners or managers should submit a new normal workforce and workplace management plan to their local governments prior to the resumption of work. There will also be limitations in the number of persons allowed inside an establishment, such as malls and shopping centers, at any given time. The House leadership is planning to extend the session until Thursday next week to pass COVID-19 related measures before Congress adjourns sine die on June 5. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
Jago William, we are on board the UNTV radio mobile booth and we are here in Ortigas Avenue in Pasig City. Let's take a look at the current situation on the road. Jago Williams, so far we have a light traffic here in our area along the westbound lane of Ortigas Avenue going to EDSA. There's also light traffic along the eastbound lane going to Pasig proper. We are anticipating an increase in the volume of vehicles in the coming days once Metro Manila shifts to general community quarantine. Jago William, just to share the information, here in Pasig City, as of May 27, the city records 555 recorded confirmed cases, 237 recovered cases, and 69 deaths. The National Center for Mental Health reveals its crisis hotline received a number of calls 5 times higher during the COVID-19 quarantine period. In today's Senate committee hearing on health and demography, its director Dr. Ronaldo Cortez says compared from the 60 to 80 calls per month before the COVID-19 pandemic struck, it rose to 300 to 400 calls per month when the lockdown began.
There are a lot of people wanting to communicate with the experts that we place in the crisis hotline that actually were mostly due to anxiety and depression because of the quarantine lockdown that has been going on.
The center says they are also in support with the Overseas Workers Welfare Association or administration to extend help to overseas Filipinos who have returned home. Meanwhile, the Department of Health also expressed support on the proposed bill seeking to amend the Republic Act 11036 or the Mental Health Law. Earlier this month, Senator Sonny Angara filed the Senate Bill number 1471 to add a provision that would reinforce existing laws which provide service users to immediately receive compensation benefits and special assistance should they sustain a disability while in the performance of duty. Angara cited the case of Corporal Winston Ragos, who was shot by a policeman last April in a quarantine checkpoint in Quezon City.
Hindi na sana maulit yung mga ganong klaseng mga insidente kasi ang conclusion seems to be that had he access to his medicines, perhaps the incident could have been prevented and he would have acted in a different manner.
Health Secretary Francisco Duque III has ordered the PhilHealth to review its case rates, which is currently at 7,800 pesos, and increase the support value to patients with mental health conditions.
And for the news abroad, here's Marielle Latoza live from Perth, Australia. Good evening, Marielle.
Good evening, William, and of course to Harleen and Diego.
Yes, Marielle, what have you got for us tonight?
William, residents in Western Australia await the reopening of intrastate travel beginning tomorrow. This is very important for Western Australia because it is their day on Monday. Later, William, I will also tell you why Chile's hospitals are experiencing an avalanche. While in Brazil, the indigenous tribes in Amazonas celebrate the construction of a new hospital.
All right, Marielle, go ahead and tell us why.
Here in Australia, from May 29, that is tomorrow, Friday, the western part of the country will reopen intrastate travel to residents. This is in time for the state's long weekend in commemoration of the Western Australia Day on Monday, June 1. This means Western Australians are now allowed to travel to Geraldton and Calgary in the north. However, going to the Kimberley region is still restricted for biosecurity reasons. In the south of the river area, it is now possible to go on a long drive to Albany, Margaret River, and Peel region. Premier Mark McGowan is encouraging his constituents to go around and appreciate their state and patronize local businesses. This is in spite of recording new COVID-19 cases from the livestock carrier ship Al Kuwait, which arrived in Fremantle Port on Friday from the United Arab Emirates. It is a live export ship which was supposed to pick up 56,000 sheep to be delivered to Kuwait. Western Australia is keeping its interstate borders closed to travelers from the country's eastern states, despite pressure from the federal government for each state to break down border restrictions. Presently, a total of 7,140 cases has been recorded in the country, with 103 recorded deaths. New Zealand's Ministry of Health says it has no new cases of coronavirus infections to report today. The total number of confirmed cases among Kiwis remains at 1,154, which is the number reported to the World Health Organization. There are 12 additional recovered cases, meaning this total is now 1,474. Only 8 cases remain active. New Zealand's Ministry of Health notes that it has added the case of Aileen Hunter, a resident from St. Margaret's Hospital and Rest Home who was in her 90s when she passed away on Sunday. She was regarded as having recovered from COVID-19 at the time of her death, and COVID-19 is not recorded as the primary cause of her death. But after consideration, it has decided to include Aileen's death in its overall tally of COVID-19 related deaths. This means the number of COVID-19 related deaths in New Zealand is now 22. It underscores there is no one in New Zealand receiving hospital-level care for COVID-19. The government calls for continued hard work by all New Zealanders to ensure zero cases will continue, as well as the downward trajectory of cases, and they don't face the second peak. The avalanche of coronavirus cases in Chile could lead to the collapse of hospitals in the South American country, according to the Chilean authorities. Outside hospital emergency wards, ambulances must wait up to 8 hours for patients to be admitted, as relatives of coronavirus patients said their parents have waited days to be transferred to the intensive care unit. The emergency and intensive care services of public hospitals are working at full capacity due to the high number of patients they receive day and night. Chile is the third most affected country in Latin America after Brazil and Peru. President Sebastián Piñera said on Wednesday that the public health service is very close to its maximum capacity. Chile is just below China in the global tally with over 82,000 cases and 841 deaths according to the data. A hospital that's first of its kind opens in Manaus, Brazil. It mixes inputs from the health experts and the indigenous peoples of the Amazons. Piz Perez, who's now in Brazil, will give the details why.
A hospital specializing in care for Brazil's indigenous coronavirus patients has opened in Amazonas state capital of Manaus. This comes amid fears that the country's indigenous citizens are not well prepared for the spread of the pandemic into the country's interior. The Nilton Lins Hospital has the capacity for 50 beds. It mixes standard medicine with traditional custom from the region's tribes.
Now we have to support the interior of the country in this stage of the pandemic. We have the capacity to receive people from the interior, who in the majority are indigenous, in a site that is prepared for them for their culture.
Input from indigenous residents was taken into account with the construction of the hospital, and is the first of its kind in the country. Amazonas is one of the states most affected by the pandemic in Brazil. According to data from the Ministry of Health, the Amazonas has over 22,000 confirmed cases of COVID-19, with some 1,500 deaths. Manaus Mayor Arthur Virgilio Neto has publicly disagreed with President Jair Bolsonaro on lockdown measures to tame the spread of the virus.
In having no virus symptoms, it would be a catastrophe. According to Ibope, In a survey carried out by the Pelotas University in Brazil, we would have between 230,000 and 240,000 people who would be infected by the virus, although the virus is not manifested with symptoms in most cases.
Neto has been saying Bolsonaro's stance has impeded efforts to stop the pandemic. He even said that the Brazilian president boycotted all the efforts that have done in Manaus to get to a stage of good social isolation.
Brazil has partially reopened, despite being the #2 hotspot of the coronavirus pandemic. Nationally, the world's 5th largest nation has confirmed some 395,000 coronavirus cases and some 24,600 deaths as of today. But health experts believe that due to a lack of testing, the real number of infections is likely 15 times higher. They also suspect that at least twice as many people have died from the virus. Chris Perez, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news here in Australia and other parts of the globe. Back to you, William.
Thank you, Maria Latosa. You stay safe there in Perth, Australia.
And here's an update on the SpaceX crewed mission that was supposed to happen Wednesday. Well, President Donald Trump's plan to celebrate the first space launch of American astronauts from U.S. soil in nearly a decade on Wednesday hit a drawback when the mission was postponed at the last minute because of bad weather. The U.S. President and First Lady Melania Trump arrived at Cape Canaveral to a steady drizzle more than an hour before the scheduled 4:33 p.m. Eastern Daylight Time liftoff. But officials announced shortly before the scheduled launch that it would have to be put off until Saturday. It was not immediately clear if the president would return, but there had been discussions at the White House about the president attending a rescheduled launch if it was delayed.
Remember Gru, the long, sharp-nosed villain? He's a criminal mastermind in the animation who adopted 3 orphans as pawns to carry out the biggest heist in history. Well, this time, he's not despicable at all. Here's Nina Remilio to tell the details why.
Hello everybody, it's me, Gru! Want your kids to have fun while hand-washing the right way? Well, Gru and the cute and popular yellow minions from the animated Despicable Me movie franchise are back. Not for another crime or heist, but to urge people to keep their distance to help fight the spread of the novel coronavirus in a new public service announcement unveiled on Wednesday. Illumination, the animation studio behind Despicable Me, developed the PSA with the World Health Organization or WHO and the United Nations Foundation. For now, it's voiced in English by actor Steve Carell as Gru. It will be translated into multiple languages, including Spanish, French, Portuguese, and Arabic, among others. In the minute-long PSA, Gru urges people to wash their hands regularly and keep physical distance. Try fun things at home, such as dancing and cooking a new dish, and to be kind to others. Nina Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the news, May 28, 2020. I am Harleen Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I am Angelo Castro III.
And I am William Theo. Because we need to know, we will always ask why. Good evening.